Now, to discuss the worrying numbers, new numbers, we are joined via way of Zoom, Professor Julius Oyugi, a virologist from the University of Nairobi. Professor Oyugi, good evening and welcome. Thank you so much for agreeing to this interview on such short notice.
Good evening, and thank you for having me again in your studios this evening.
Yes, thank you, Professor. Now, such a spike in the number of new cases is definitely worrying. What exactly does this indicate? Could we call this a new wave?
Certainly, when you see, for quite a while now, we have been having very low positivity rates. And I think in the last few days, if you look at the statistics, the number just shot from less than 1.1% to around 11%. That is an indication that there is a clear, increase in the number of people who are getting infected with the COVID-19 virus. And there are factors which are driving these, new high numbers of those who are testing positive. So when we start seeing that, then we start getting worried that there may be another wave, picking up.
Okay. Now, the greatest fear, of course, is that the government may be forced to reintroduce restrictions like those we were under a few months back. At what point would such an intervention be necessary? And if at all, is there any other way that we could actually stem the trajectory that this wave is taking?
So let me answer the last part of your question. Is there a way that we can stop the trajectory? We can stop the government from imposing the previous, restrictions. If a wave is actually coming, yes, we can actually vaccinate as many people as possible. The problem, if you look at these new numbers, by the way, what should be worrying us is who are being infected. Are they those who are already been vaccinated, or are they those who have not been infected, but vaccinated rather? Now, those who have been vaccinated, there's a possibility that they can be infected, but they're not a worry to us, because we know that if you've been vaccinated, your chances of getting serious disease are very low. Mm-hmm. The problem is with those who have not been vaccinated. If they get infected, these individuals are likely to end up in our hospitals. They are likely to end up in our ICUs. And remember, we don't have enough ICU beds to handle large numbers of people who are having serious COVID disease. Okay. And so what we can do is to ensure that as many people as possible get vaccinated, now that we have started seeing the spike, to prevent huge number of people, getting into hospitals or in ICU and overwhelming our health systems. Okay. So I think that's number one that we need, the first thing that we need to do. The second thing that we have to do is, what has happened in this country when the government, lifted the night curfews. A lot of Kenyans thought that COVID actually ended. And if you look around, most people are now not wearing masks. They have forgotten issues of hand washing, yes, and keeping social distances. And Prof, COVID is still with us. We need to maintain all those interventions as we vaccinate as many people as possible.
There's something you said that is very interesting, Prof,
so that we prevent the spread of this virus.
Yes, because there appears to be a bug going around right now. If you look at social media, everyone is complaining about experiencing some flu-like symptoms. Now, could this be linked to the pandemic? And because it's also an indication of the fact that Kenyans have generally slackened in adhering to the protocol set by the Ministry of Health. Because if at all people are using masks and washing their hands, even this new bug going around would not. Don't you agree?
Yes, so if you think you're saying that some people are complaining of having flu-like symptoms, number one, partly it could be because of COVID, and number two, it may also be remember that other viruses that cause flu that are always circulating around. But most likely it could be because of COVID. Remember, majority of people who get COVID, about 80%, will develop flu-like symptoms and then they will recover. If they don't have underlying conditions, then they will recover without knowing that they had COVID-19 if they don't go for testing. Okay. So based on that alone, we could be getting a sense that more and more people are getting COVID, infected with COVID virus, and that should be a worry to us.
Okay, thank you so much, Professor Julius Oyugi, virologist at the University of Nairobi, shedding more light on this recurrent or the recent surge in the COVID numbers, the number of new infections that we're getting now. Let's move on to other stories. Several governors who are now serving their second and last terms in office, have expressed interest to vie for Senate positions in their counties in the coming general election.